Listen, have you ever felt completely frustrated or maybe even fundamentally broken because years of traditional talk therapies and daily pills just haven't worked for you? You're definitely not alone. But what if the problem isn't that you're beyond help? What if the medical world has just been looking at your brain through the completely wrong lens? What if your depression isn't a chemical imbalance at all? Welcome to This Explainer. Today, we are exploring a truly groundbreaking paradigm shift in mental health. We're going to unpack a profound and incredibly rich discussion between Stanford neuroscientist Dr. Andrew Huberman and the late, brilliant psychiatrist Dr. Nolan Williams. Dr. Williams was an absolute visionary, and the central premise of his work is both scientifically thrilling and, honestly, deeply humanizing. We are finally moving away from the bleak idea of a broken mind and stepping right into the era of brain-based structural treatments. Okay, let's dive into this. Here is our roadmap for today. Number 1, the evolution of psychiatry. 2, welcome to Psychiatry 3.0. 3, rewiring with magnetic fields. 4, psychedelics as chemical keys. And 5, the repairable brain. All right, kicking things off with Section 1, the evolution of psychiatry. To really appreciate where we are, you kind of have to see how psychiatry has evolved through 3 distinct eras. Psychiatry 1.0 was the psychotherapy era. Think Sigmund Freud's couch. The main belief back in the 1900s was that mental illness came from unresolved trauma or unconscious conflicts. The treatment? Well, you just talked. Now, it was a breakthrough because it finally gave patients a language for their pain, but it was incredibly slow, and for severe conditions like major depression, it often just fell short. Then, in the late 20th century, we entered Psychiatry 2.0, the chemical imbalance era. This was the boom of SSRIs like Prozac and Zoloft. The whole theory was that mental illness was literally just a lack of serotonin or dopamine. While those daily pills absolutely helped many people, it was an era of, well, intellectual overconfidence. The evidence that depression is simply low serotonin is actually pretty weak, and a huge chunk of patients don't respond to these drugs at all. Which brings us to today and the whole point of our discussion, Psychiatry 3.0, the circuit-based era. Moving right along to Section 2, welcome to Psychiatry 3.0. So, the crucial point is that this new era completely discards the old, damaging view that the mind is permanently broken or flawed. The new view grounds psychiatry firmly in hardcore neuroscience. Mental illness is not a character flaw, and it's not just some bad chemical soup that needs stirring. Your brain is a physical organ exactly like your heart or your liver, and just like those organs, it runs on electrical wiring, neural circuits that govern your mood, your threat response, and your emotions. Sometimes that wiring just gets stuck in faulty, maladaptive patterns. It doesn't mean you are broken. It simply means your brain's circuitry needs a recalibration. Okay, so how do we actually achieve that recalibration? Through neuroplasticity. This is absolutely the master mechanism of Psychiatry 3.0. For decades, scientists literally thought the adult brain was fixed, that by a certain age, you were basically stuck with the architecture you had. We now know that is entirely wrong. Neuroplasticity is the brain's incredible ability to physically change its structure, form brand new connections, and update its patterns in response to experience. The real challenge is that in conditions like depression, those dysfunctional thought loops become deeply entrenched. The breakthrough treatments we're about to look at work by temporarily opening up special windows of neuroplasticity. This allows the brain to safely jump in and rewrite those entrenched dysfunctional patterns. That brings us to Section 3, rewiring with magnetic fields. Enter transcranial magnetic stimulation, or TMS for short. This is a brilliant, non-invasive brain stimulation technique. Imagine a specialized coil placed gently against the head. That coil uses rapidly changing magnetic fields to induce tiny, highly targeted electrical currents in very specific brain tissue. It can safely excite or inhibit neural activity right where it's needed. For example, in depressed patients, the left prefrontal cortex often shows severely reduced activity. It's sluggish. TMS can basically wake that region right up. Now, standard TMS has actually been FDA approved since 2008, but it definitely has a catch. Patients have to come into a clinic for daily sessions over a super long period, usually 4 to 6 weeks, and sometimes those results can eventually wear off. Let's move to and see how this builds into something truly mind-blowing. That time limitation is exactly where Dr. Williams' Stanford Neuromodulation Therapy, or SNT, becomes totally revolutionary. His team took standard TMS and applied something called spaced learning theory. Think about how you study best, not by cramming all night once, but by taking in information in bursts with brief rest periods in between, right? Well, SNT does exactly this for the brain. It delivers highly concentrated, clustered magnetic bursts with very specific rest intervals, multiple times a day. Because of this optimized pacing, they condensed a grueling 6-week treatment into just 5 days. 5 days. And the results? They achieved unprecedented remission rates for treatment-resistant depression. We are talking about people who had failed multiple prior treatments, who were walking out of the clinic symptom-free in under a week. It is an absolute game changer. All right, shifting gears to Section 4, psychedelics as chemical keys. Now, before we look at the specific compounds, I need to heavily emphasize a critical point from Dr. Williams. We are not talking about recreational drugs or spiritual sacraments here. We are talking about highly controlled, precise pharmacological tools. In a clinical setting, the set and setting are carefully, meticulously managed. There is strict medical supervision the entire time. And most importantly, there is mandatory therapeutic integration. You see, the psychedelic experience itself isn't the cure. Rather, it opens up a massive window of neuroplasticity. And a highly trained therapist is right there to guide the patient to use that open window to form new, healthier neuroconnections. I can't stress this enough. There is zero recreational experimentation happening here. Now, what's really interesting about this slide is seeing how these different chemical keys unlock completely different doors in the brain. Look at the mechanism for psilocybin, the active compound in what people call magic mushrooms. Its primary clinical mechanism is dramatically disrupting the default mode network, or DMN. The DMN is basically your internal monologue. In depressed patients, that monologue gets rigidly stuck in agonizing loops of negative self-talk. Psilocybin literally shatters those loops, allowing the brain to approach old problems from an entirely new perspective. This makes it incredibly effective for treatment-resistant depression. On the flip side, look at MDMA. It operates entirely differently. It temporarily suppresses the amygdala, which is your brain's primary threat detection center, while simultaneously flooding the brain with serotonin and oxytocin. For someone living with PTSD, their threat circuitry is chronically stuck in overdrive, in constant hypervigilance. MDMA creates this incredibly safe emotional window where fear is dialed way down. This allows the patient to finally process horrific trauma without their prefrontal cortex shutting down in a state of panic. And this brilliantly illustrates the real-world impact of that science. The efficacy of MDMA's specific mechanism is just staggering. In recent Phase 3 clinical trials conducted by MAPS for severe treatment-resistant PTSD, therapy alone sat at about a 32% remission rate. But when you look at MDMA-assisted therapy, the remission rate absolutely skyrockets to 71%. That's more than double. We are talking about people who have lived with debilitating daily trauma for decades, suddenly finding their symptoms completely gone. The underlying clinical data here is, without a doubt, some of the most compelling in the entire history of psychiatric research. Beyond psilocybin and MDMA, the conversation also highlighted an ancient, powerful compound called ibogaine, derived from a Central African plant. Ibogaine is incredibly unique. It triggers a massive 24 to 36-hour experience that patients often describe as a compassionate life review. Dr. Williams noted its astonishing potential for treating what's known as moral injury, especially prevalent in combat veterans. Moral injury isn't just fear-based PTSD. It is a deep, agonizing psychological wound of guilt or shame from feeling like you violated your own moral code. Ibogaine somehow allows patients to review these traumatic memories with a profound emotional objectivity, finally granting themselves empathy. Amazingly, it also shows miraculous promise in practically eliminating opioid withdrawal symptoms overnight. However, there's a big caveat: it requires intense medical and cardiac monitoring, as it can have very serious effects on the heart. It is a wildly powerful tool, but one that demands absolute clinical respect. We're also seeing similar behavioral resets with ayahuasca, heavily aiding in addiction recovery, but again, only when administered under very strict medical watch. And finally, Section 5, the repairable brain. You know, one of the absolute most damaging side effects of the old chemical imbalance model was that it made patients feel like they were fundamentally broken at their core. If a doctor labeled you treatment-resistant, it honestly felt like a life sentence. But Dr. Williams reframed this so beautifully. If depression is actually a circuit-level dysfunction, then the label treatment-resistant simply means you are resistant to the standard pills and standard talk therapies we've thrown at you so far. That's it. It absolutely does not mean you are impossible to treat. The ceiling of what is actually treatable in mental health has been drastically underestimated. Your brain is a highly repairable organ. Dr. Nolan Williams tragically passed away, but he left us with a profoundly optimistic legacy. He treated psychiatric illness with the exact same intellectual and biological seriousness that a top-tier cardiologist brings to heart disease. He believed deeply in the brain's incredible capacity for change. Think about it. We don't blame a heart for having an arrhythmia, do we? We don't judge it. We just go in and fix the electrical signaling. Dr. Williams believed we must extend that exact same grace and that exact same clinical precision to the human mind. Mental illness is a biological problem, and as we've seen today, it is highly, highly amenable to biological solutions. So what does this all mean for us? The future of mental health isn't about just managing permanent damage for the rest of your life. It's about targeted, precise healing. It's about safely opening windows of neuroplasticity and letting the brain do what it inherently does best: adapt, rewire, and recover. So as we wrap up this explainer, I want to leave you with this final empowering thought. What part of your own mental circuitry might simply need a recalibration?